When people hear the word shrooms, it often comes with a sense of fear or uncertainty. Magic mushrooms are seen as a dangerous psychedelic drug, banned by the FDA in 1968 through the Staggers-Dodd bill. But what are mushrooms exactly? Magic mushrooms are hallucinogenic fungi that release a compound called psilocybin. When ingested, this compound affects the prefrontal cortex of the brain, which regulates abstract thinking and thought analysis. Psilocybin targets serotonin in the brain, triggering vivid hallucinations and a sense of euphoria. Despite being a Schedule 1 drug, meaning there are research limitations, researchers in the medical field have been able to conduct a number of experiments on the positive uses for the psychedelic. Mushrooms may be a potential treatment for depression and mental illnesses, various addictions, and are able to develop the brain's creativity. Magic mushrooms have been used recreationally for years, though illegally, but the medical opportunities of the drug may be too great to pass up on. And, recreationally, in a safe environment, shrooms could have a positive effect on the way we view ourselves and the world. The federal government should legalize magic mushrooms because they may play a major role in treating depression in the coming years. The FDA has recently approved the research and labeled the findings as breakthrough therapy, meaning it's on the fast track to be potentially used as a treatment. The result of this research has shown that psilocybin may be able to mentally reset a patient's brain, potentially giving them the temporary kickstart they need to break out of their depressive states. Instead of taking antidepressants, patients took 2 doses of psilocybin in 5 weeks. Many individuals showed improvement after just 1 week. Some research showed that even 1 dose was able to alleviate the depressive symptoms permanently. Researchers said that due to the release of serotonin in the brain, patients were able to reconnect with their emotions and increase their emotional processing. This varies greatly from antidepressants, which instead suppress and dull those same emotions. Magic mushrooms also lack the side effects of antidepressants: insomnia, fatigue, indigestion, and weight gain, just to name a few. This treatment could be huge for people suffering with depression. The doses are less frequent than daily depressants and could be relieving for individuals with depression due to cancer and other serious illnesses. A study out of New York specifically studied how the drug might affect cancer patients with severe anxiety. Nick Hernandez, a participant in the study, said, "Something inside me just snapped. I realized that all my anxieties, defenses, and insecurities weren't something to worry about." Mushrooms may be the answer to many different addictions and bad habits. Shrooms are able to shake someone from their routine and give a glimpse of a larger picture and create a mental plasticity with which people can step outside of those problems, said by Matthew Johnson, the leader of a mushroom study at Johns Hopkins University. Now, this study at Johns Hopkins found that psilocybin therapy significantly improved abstaining from smoking over a 12-month follow-up period. More research studying psilocybin's effect on alcoholism found that following treatment, both drinking and heavy drinking declined. Yet another study out of Alabama, as of a year ago, is currently conducting trials for the effect psilocybin has on cocaine addiction. And because shrooms hold no addictive traits themselves, the occasional dose would be perfectly safe. While digesting too much psilocybin may cause physical harm, if one uses this plant safely, they would be able to responsibly ingest and benefit from the effects of psilocybin. Because shrooms are able to combat addiction, legalization of them could result in the general public utilizing the psychedelic to overcome addictions to alcohol and drugs like nicotine and cocaine. While mushrooms can be abused recreationally, small doses and understanding the responsibility that comes with consuming the drug can lead to a positive effect on the brain's growth and creativity. New research provides more evidence that psilocybin, the active ingredient in magic mushrooms, can improve creative thinking, empathy, and subjective well-being. As seen on SciPost.org, a couple of years ago, Maastricht University in the Netherlands conducted a study on 55 individuals to record testing in creativity and empathy during the psychedelic trip. The head of the study, Natasha Mason, said, "We have found that psilocybin when taken in a naturalistic setting, increased aspects of creativity and empathy the morning after and 7 days after use. Furthermore, psilocybin also enhanced subjective well-being. Interestingly, changes in well-being correlated with changes in empathy after psilocybin use. The results showed patients, just a week after their microdosing of psilocybin, with enhanced creative thinking that allowed them to break out of their old patterns of thought and generate new and effective cognitive, emotional, and behavioral strategies. For individuals with negative thoughts and connotations about themselves and others, this psychedelic could be the answer to positively looking at the world. It could potentially restore relationships and lives if legalized. People could begin to experience personal growth again, instead of being trapped in a cycle of orthodoxy and stagnant development. Magic mushrooms have been around for hundreds of years. Central Americans were using the psychedelic before the Europeans landed on the continent's shores. It has been outlawed for years in America, but we are beginning to understand the benefits of the drug. Just a few days ago, shrooms were legalized in Oregon for medicinal and recreational use. Now, magic mushrooms are still dangerous. While the chances of hurting yourself or others while tripping on mushrooms is extremely low, it is still a possibility. That is why, even if legalized nationally, mushrooms shouldn't be taken lightly. It is a serious drug that shouldn't be taken without full awareness of the risks involved, however low. Someday in the near future, though, the health benefits of magic mushrooms may outweigh the cons of legalization. Thank you.